I can see that we now have our attendees starting to join this webinar. I'm so excited to have all of you with us today. I can just introduce myself quickly. My name is Joanna Tenkate, and I work at Global Heart Hub as their patient community engagement and development lead, and I am so excited to be here today. For anyone who may not know, Global Heart Hub is an alliance of heart patient organizations and advocates aiming to create a unified global voice for those living with or affected by heart disease. This is the second of our new Empower webinar series, where we partner with patient organizations around the world to respond to the questions and needs of patients. And this webinar is being jointly hosted by Global Heart Hub and AEPOVAC, a patient organization based in Spain, in support of the shared commitment to reaching and empowering the global patient community and creating a collective voice. We are especially excited to partner with AEPOVAC on this session, as they recently published the book, Different Hearts, Adults with Congenital Heart Disease, which collected and uplifted the experiences and voices of congenital heart disease patients. Now, I want to welcome everyone to today's session. We are going to be talking about what patients, carers, families, and friends should know about those living with congenital heart disease, and what advocates want everyone to know about living well. Just as a little bit of housekeeping, I want to call attention to the fact that this session has live audio translations into Spanish. So if you'd like to hear this session in Spanish, please select the translation room feature. I also want to note that this webinar is being recorded and will be made available online after the event. And with that, I'm excited to introduce our speakers today who will be covering this important topic. So we have Dr. Bunty Ramchandani, a congenital cardiac surgeon, Elena Gallego from AEPOVAC, and Mallory Streaker, a patient advocate with congenital heart disease. And we'll be getting to hear from each of our speakers first so they can offer their introductory thoughts. And then we're going to be getting into a moderate discussion with all of our panelists about what we need to know about patients with congenital heart disease and how we can support anyone in our lives with the condition. So to get us started, I'd love to ask Dr. Ramchandani if he could introduce himself and tell us why he wanted to speak here today.
Hi, my name is Bunty Ramchandani, and I'm a congenital cardiac surgeon in 2 tertiary hospitals here in Spain, in Hospital Universitario La Paz and Hospital Universitario Ramón y Cajal. And I would first of all like to thank AEPOVAC and Global Heart Hub for inviting me to join in this webinar today. And basically, I would like to thank them also for trying to make these kind of webinars and meetings in order to overcome the barriers that sometimes patients and doctors might have regarding of information and regarding sometimes simple questions that could occur in day-to-day life. So one of the main reasons of coming over here is trying to get closer to the people who might need more information, who are out there.
Absolutely. Thank you so much. So Dr. Ramchandani, I was wondering, to get us started, could you give us just a basic understanding of congenital heart disease, what it is and what it means to have it?
Yeah, sure. Congenital heart disease is basically when one or more cardiac structures or vessels have been affected or are altered at birth. It is the formation of the cardiovascular system is very complex. And it's complex basically because it integrates 2 types of systems, the systemic and the pulmonary. So basically the whole orchestra of creating these 2 systems is like, if you could understand, it's like a symphony. So when there's one musical note which is out of place, that could result in a congenital heart disease. So basically congenital heart disease is that any alteration of a cardiac structure or vessel.
Absolutely. Thank you for that. And within the field of congenital heart disease, are there any recent developments that you would want patients to be aware of?
Well, there are a myriad of technological and scientific developments, but the ones that are being published lately and which are in the mouth of many surgeons are things like mitochondrial transplantation, which is, for example, I'm involved in an investigation in this field specifically in the university in the Complutense. I'm a research fellow too over there. And basically, this type of transplantation is like changing the batteries of cardiac cells, and possibly could be used for transplantation in order to preserve the organ better, or after aggressive cardiac surgery, when the heart is a bit is not working properly, trying to give it more energy by basically changing the batteries of the cells. There are other things which are also in the mouth of the surgeons, like 3D printing or artificial intelligence and augmented reality. Even, for example, blockchain technology is right now being used in South Korea, basically for patient information. So patients can go from hospital to hospital with all their medical information without need of CDs, or without the loss of information during the process. And then there are also technological improvements, for example, in ventricular assist device, which are little by little, there are little experience in some kind of improvements, but right now there are people trying to implement these improvements to see if it is worthwhile, if it's beneficial for our patients.
That's really interesting. And I could kind of follow up on what recent developments not just mean for patients, but how they might be able to access that kind of information, because of course, some of this might be a little clinical or a little bit hard to understand. How do you translate this information for patients, or how would you recommend they get their heads around it or understand what it means for them?
Yeah, currently there's a lot of information out there. Some of the information is very technical. Some, for example, when you go to the genetic area, it's even technical for surgeons like me. You need help from other colleagues to interpret the results. The best way of trying to access this information is trying to access it through media, through websites which are accredited, which are backed up by an official organism, where the information you read it's an information which has been verified by a clinician or verified by any scientist. Because right now there's a lot of information. Some of it is correct, but others we have to be critical in while we are reading it. So the best way is to go through this myriad of information is trying to identify websites which are official, talking directly to your physician and asking them directly the questions. Sometimes the questions could be too sophisticated, and the physician might need to do a bit of research in order to answer these questions. Or even in social media like Twitter, TikTok, try to go to accounts which are accredited, which are official, because basically because there's a lot of information, and like we're in a society where sometimes the information is not true. So we have to be critical with the information we accept.
Absolutely. That makes a really good point. And you've also touched a little bit on something else I'd love to get your opinion on, which is that relationship you have with your patients. So what have you as a clinician learned from engaging with patients, and has the way you practice medicine ever changed because of an interaction with a patient?
I learn with the patients nearly every day, because one of the realities of medical training is that one receives training to meet the medical needs of our patients, and but as a surgeon, as a doctor, you see that sometimes this is quite short from the real needs that the patient has. And as a doctor, one of our main objectives is to accompany our patients through the medical needs, but even through other needs which they have. And one of the things I learn every day, and one of the things I take pleasure, is to see how they thrive, how they grow, how to try to understand other kind of difficulties they might have, which are not medical related, but might be related socially, or might other needs that could come. So sometimes this type of information, this type of feedback makes you more thoughtful as a surgeon, especially while you have to take decisions. And it reminds you that although it's for us, we follow our clinical decisions are based on on guidelines, on medical guidelines, but also tries to put the patient in context of those guidelines, because sometimes a guideline recommendation might be good in theory, but for that patient would not be the right solution. So from what I learned with the patient is that there are other needs that must be fulfilled apart from the medical needs. And it's basically a way of having the patient where they should be from the first place, in the center of the whole thing.
Absolutely. That's really good to hear. And I guess I'd be curious to know, in a clinical sense, coming from that question, when you're working with an adult with congenital heart disease, what advice or guidance do you give them day to day in living well? What kind of signs do you tell them to be on the lookout for? When should they be checking with their doctor? That kind of thing.
That's a difficult question because it depends. For me, any patient with congenital heart disease should have a physician, a dedicated physician following him or her, because sometimes waiting for symptoms might be too late. So the best thing, my recommendation for any patient with a history of congenital heart disease is to book an appointment. If they don't have any physician following them up, a dedicated physician following them up, is to book an appointment with a physician. And depending on that condition, because congenital heart disease is a really big spectrum of conditions, so it's important for the physician to know which condition they have and see the evolution of the patient. And in this aspect, one of my main recommendations is that they find a dedicated physician, a physician who is dedicated in congenital heart disease, because it's a completely different subspecialty in cardiology or cardiac surgery. And it is like taking a racing car to a normal garage. You wouldn't do that. You need a specific engineer or mechanic. So that's the same thing. If you have a very specific condition, the best thing is to go for that type of dedicated physician.
That's really interesting, sort of having targeted resources and support that understands that specific condition. And that's actually a topic we'll be getting into a little bit more in a while. Thank you so much for your introduction, Dr. Ramchandani. So excited to have you here. I look forward to hearing more of your thoughts when we get to the moderated discussion. But now I might turn to Elena. Elena, if you could introduce yourself and talk a bit about your work with the congenital heart disease patient community.
Hello. My name is Elena Gallego. I'm really pleased to be here, to be part of this webinar. And I am the support in the communication area of AEPOVAC, which is the Spanish Association of Heart Disease Patients. I participate in this webinar on congenital heart disease, representing Cecilia Salvador, president of AEPOVAC and patient of congenital heart disease. So I will try to transmit and convey her feelings in the best possible way. I know she's listening to us, so she will be able to, to be here and, to just from the distance to send me really her feelings and her regards. Always when I talk to Cecilia as a patient, there is something important, and this. When you talk to medical professionals and family, friends, there is always one adjective or description that defines perfectly the congenital heart disease patients, and is they are really brave, valiant, courageous, because from the early childhood they are used, and for the whole life, all through the life, they are used to fight, and not only with the disease, but also with the society in many occasions, and also facing each revision or operations with the fear that, it can be, difficult, or maybe the results. And so they are really brave. I mean, they're really, for me, this is the most important, courageous, really a fantastic person. But the important is for AEPOVAC and also for the patients to try to transmit that idea of hope and really that strength and power to the other patients, also to the families and other members and friends, and and also to the physicians as well, because as the Dr. Ramchandani mentioned, it is important for them to understand the patient situation and to have the patient's point of view. And so it's important to be together in terms of that, making decisions and to treatments, etc. Well, and here I'm here as well to show the book. There is a book, and I'm here. The book is a fantastic one, and really and encourage the audience and the participants here to download this book from the AEPOVAC website. Is AEPOVAC, www.aepovac.es, because it is it's a learning. Here you can see learnings from the patients, really, and not only from the patients, also for the parents, some stories telling from the mom and dad's point of view, which is really important. One of the things that Cecilia mentioned to me, and I said it is important for the patients to deliver a message, and is that they want to deliver, they want to give a voice to adults as well, to adults affected by this disease, because they have been through that difficulties all along their life. Also to provide with, to offer visibility to the pathology through the case, to the testimonials, and also to support other patients and potential patients and parents of children with congenital heart diseases. The title of the book is Different Hearts, Adults with Congenital Heart Disease, and it is included a shorter reference that is it's like a long distance race towards a better quality of life. It's like a long race, so that is important for, you know, for the community as well, to feel that you have to see those patients as it's really, you know, not as a patients, as a normal people, that they have normal lives with their normal jobs, and you know, because they will, at the end of the day, they will be at any point of their lives, the people will understand that it can be, in a way, patients or families or caregivers as well, and it's important to understand that.
Absolutely. And I'm hearing some of these themes that you're saying are called out in the book of bravery, resilience, a lot of hope. Can I ask, what was it like working so closely with the patient community and the clinical community? What were those key messages that you want to make sure that they understand?
There is, for me, when I mention patients, I mention the concept brave and valiant. And also when I mention patient associations and physicians, it's like the perfect circle, if you want, the perfect loop, because the message is we have to work together. The patients has to transmit their feelings. They have to, you know, to transmit that idea of story, life stories, and the idea of we can overcome that if we have overcome the situations, the difficulties of their life. Is something that you maybe can be a patient, a potential patient, or maybe just diagnosed with that type of disease, which is really a difficult disease. It's something that you can do as well. And also you have obviously the associations like AEPOVAC, which is important because we are many times, we are the body that connects the patient with the physicians, which many times is a difficult conversation, because sometimes the you know, patients, they are a bit, I don't know how to say that, they are a bit blocked with the situation, they overcome the situation. And it's important for them to understand that they have all the medical professionals that they are going to take care of the patients, but they need that type of conversation messages to deliver together between both sides. So that will be the perfect symbiosis, if you want, the perfect group. And apart from that, from the association point of view, we try from AEPOVAC, we try to support the patients in a legal rehabilitation, healthcare point of view, social point of view, because still we are working on trying to educate the society, to see the, for example, the congenital heart disease patients like, like a people who is not necessary, to have a specific treatment. They can run they can work in a normal job, and they can have a normal lives, because if you see in the book, we have 16 different testimonials where you can see that all of them, they are fantastic people, fantastic, and now they are adult patients, but they have been from, well, most of them, they were born with a congenital heart disease, but now they have a normal life with children as well, themselves. And so it is a message to deliver, really.
Absolutely. Well, thank you so much, Elena. It's wonderful to hear more about AEPOVAC's work, and especially all of the effort you put into this book, which I know does such a great job of uplifting those stories of resilience and having a good, life that they've had, despite this condition. And we're also so glad to have you as a partner on this webinar. Of course, we'll get to hear from you more in our discussion, but now I would love to ask Mallory if she could introduce herself and tell us her story about living with congenital heart disease. Mallory, would you like to get us started?
Hi, my name is Mallory Streaker. I was born with a congenital heart defect. First of all, thank you, Global Heart Hub and AEPOVAC, for having me here to talk. I'm very excited about it. So I was born with Ebstein's anomaly, which is a tricuspid valve defect. They knew pretty much right away when I was born because I turned blue. I was pretty good throughout my young childhood. It wasn't until I was about 12 years old that I had to have my first open heart surgery, and that's kind of when everything started.
That sounds like, quite a young age to have to go through something like this. Would you be able to tell us a little bit more about what that journey was like from 12 onward? How did it shape your life, and what sort of lessons did you take from it?
Oh man, well, when you're that young and you have open heart surgery, two different things happen to your brain. The first one is you grow up really fast. The second one is you kind of get stuck emotionally at that age. You have so much to deal with physically. Your peers do not understand you anymore. There's just no way that they could ever relate to you. But then you just also kind of have to shut off what's happening to you emotionally, and then it's kind of really hard to come back from that. So my younger years were really difficult. I had another open heart surgery at 16. So those years were just a lot of not understanding how to regulate my own emotions, but also sort of living in a world where I really had to be an adult, with taking my medications, going to my doctor's appointments, which of course I had my parents to take me at that time. I was lucky enough to still be able to be pretty active every once in a while, kind of between open heart surgeries. But it was hard when you have a congenital heart defect, especially a right side congenital heart defect like Ebstein's anomaly. You really struggle with stamina. So there was a clear difference between my peers and I did ballet. Between what I was capable of and what I wasn't capable of, or what they were capable of. I loved that I could be active. I loved dancing, but it was also very hard to watch other kids my age not struggle with these issues and not have to take break string classes. So I definitely felt very kind of isolated during those years. And it really wasn't until, gosh, I would say my mid-20s where I really started to feel like my diagnosis was actually working for me rather than against me. It wasn't until then where I kind of found ways to start using it to my advantage and using it to be different in a good way and inspire other people.
That's really interesting. And it kind of sounds like a big part of that transition came as you were also transitioning into adulthood. Does that sound right? Or what other kinds of transitions did you find, sort of going from a young, very young person with this condition to sort of your own person and sort of taking responsibility for your own condition?
So I really wanted to be independent, like as soon as possible when I got older, because I had relied on my parents so much to take care of me when I was young. I needed so much help a lot of the time. So when I was out of the house and went to college, I just wanted to take care of myself. So I very easily transitioned from needing mom and dad to take me to the appointments and go in before I was 18 to like, I got it. I don't really let my parents come to appointments. I just really needed that independence. So for me, that was a pretty easy transition because I wanted it so badly, and I hadn't had that. But then when I was in my mid-20s, I went into heart failure and needed a lot of help again. So kind of reverting back to, feeling like a kid, needing all that help, moving back home with mom and dad. That was definitely a tough one.
Mhm. Absolutely. Sort of considering those challenges that you faced, I'm wondering if you might be able to share a little bit about which resources and support you found were most needed or most valuable to you.
So I used to be pretty involved in social media. I don't really do that anymore, but at the time of being in heart failure in my 20s, that was a huge resource for me of support. I just posted a lot on social media about being in heart failure. I was always really positive. I did some organ donation awareness events. I did a lot of outreach for that. And I kind of on accident just started attracting a following of other women, specifically with congenital heart defects, which prior to that, I had never really known any. I knew they were out there, but I had never really talked to any women with that same issue. And that was a huge deal for me emotionally, is having that support. And then as well as just finding like a really good therapist. I was lucky enough that I was given like a special congenital, or not really congenital heart defect. I think it was just like a heart failure psychiatrist or something. So he was put on my team pretty early on at the Cleveland Clinic, and I still see him to this day. So that was a great resource, and I'm sure that not every hospital has that. So I was really lucky to find that.
That's amazing. And I hear you also mentioning kind of a sort of steps into patient advocacy. And I know that now you've become a really strong patient voice. How did you first become interested in advocacy? Did it happen kind of naturally or by accident, or is it something you kind of dove into? And how did your experiences with congenital heart disease shape your goals?
So yeah, it definitely kind of happened on accident. It started with the social media thing, and even through my heart failure, I don't want to say like pretty active, but I was active as possible. I would like pull myself to the gym maybe twice a week and just like sit on a bench and lift like little 5-pound weights. I would go for slow walks. I was still like going on some vacations with my friends and posting those things while also waiting on a heart transplant. I guess really inspired other people who had congenital heart defects or who were maybe waiting on transplants. And I didn't really like realize it was going to do that. And I just had like an outpouring of support and people talking about how great it was to see me so positive. And then I continued with the social media when I had the transplant. I was like living in the hospital for a few days, maybe like a week prior to actually getting the transplant, and kept up with my social media through that while I was in the hospital. And then when I came out of the transplant, and maybe, I don't know, 6 months later, was really recovered and started getting really serious into the gym and weightlifting. And then I got into bodybuilding, and the support just continued. And I realized like, wow, I think I really have something here that I can go forward and encourage patients with. And then Global Heart Hub found me on social media, and that's kind of, I've been on this route ever since.
Well, I can say for one that we are very happy to have you here. I really appreciate you sharing your story and your perspective with us, and we'll be able to hear more of it, of course, as our conversation goes on. But we just know how important it is to hear directly from patients with lived experience. So thank you, Mallory. I do think now would be a great time to get into our moderated discussion so we can bring all of you to the table and have a bigger conversation. All right. So if I could return to you, Dr. Ramchandani, sort of from a clinical perspective, what advice would you give to families and parents of children born with congenital heart disease, especially those who might be feeling overwhelmed or unsure of how best to move forward, especially knowing that children can, of course, be living very different lives to other kids, as Mallory pointed out as well.
Mm-hmm. I understand it's a very difficult situation because when you get the first diagnosis, or the first news about this situation, it's like entering in a new, completely new field. And you start listening to physician, and they start saying odd words that you don't understand. So it's also a completely new language. So one of the main things that which I consider could be a limiting factor is trying to connect with what other people are telling you, because sometimes the words are complicated, the concepts are complicated, even the concept is complicated for other fellow physicians who are not related to this field. So if you give a diagnosis to a patient or to a family of a very complicated disease, in first instance, they might not understand it completely, so one of the first things is trying to get a clear picture of what's happening to your family member, to your kid, or to yourself. And try to add to that information with the knowledge you get from other support areas, groups. You might access the social media, because nowadays that's inevitable, and Mallory has done a great job doing that, because sometimes one feels extremely alone. You get this condition, you think it's the last sentence, it's like a sentence, you're sentenced, and you are, from what talking with other families, they feel completely alone. And what you need at that moment is to connect with other people, to try to see that you are not alone. There are other people with a similar situation. You get to know that their experiences, they transmit knowledge, especially other patients, other family groups are excellent knowledge donors, as I call them, because they are many times capable of transmitting vital information in very simple words, so people can understand. Sometimes we doctors or clinicians try to convey the complete, we try to give a complete information, a very sophisticated information, but that might not be the right way of transmitting the information in the first step. Sometimes it's important to process, to digest information, and trying to give it little by little. So when you get this first type of information, it's critical to not have any doubts. Don't be shy, ask the questions. If you do not understand the question, say it. I do not understand, please explain it to me again. Once if you're explained, it's normal not to ask all the questions in the first round, because once till you digest, you interiorize all the information, sometimes you start having questions later on when you're back home. I recommend all my patients to write down all that questions in a piece of paper, in the tablet, in the mobile phone before the second visit, because once you have a couple of days of thinking, going through it, and then you can have a complete list of questions that you might have, and all questions are completely valid, from very relevant questions regarding life expectancy, mortality, and also other questions like, might I be able to do CrossFit because I used to do it, or might I can I use my iPhone because I've got a pacemaker over here. Things that you might think, well, how can I ask this? It sounds silly. No, all questions are completely valid. The most important thing is not to have any doubts. Mm-hmm. And the best person you can access is the physician you have in front. But if you still have other doubts, if you still need to contact people, need to know that there are other people in the same condition, therapists, groups are excellent for this. People in social media are really, as you said, patient advocates, and they do inspire people and they do console people, because one of the main fears is to be alone, to feel alone, and people are not alone. There are many people with similar conditions, and simply knowing their life story is really helpful, because you could see that they have been able to manage, or they're managing the situation, and if they are able to do that, you can do it too. So I think that those are the three things: the doctor,
Absolutely.
groups, and other people that to serve like an inspiration.
That's really good to hear. And I mean, it's so helpful to hear that sort of balance of having some peers and some people that can help you not feel alone and have a community around you. And then looking at your physician as a resource, asking them all the questions that you do have, so you can feel equipped and you can feel like you have the information you need to make an informed decision. Mallory, I wonder how you would look at this from a patient advocate's perspective, because something that really strikes me in your story is how so much happened during the early and formative years of your life, which of course is true of others with congenital heart disease. What do you think parents, families, and clinicians should keep in mind when engaging with a young patient?
I think my mom is watching, so hi, Mom. So the biggest thing that I can recall is your child does not have room for any emotions but their own when they are going through this. So it's very helpful to have parents, especially, who are great at keeping their own emotions in check around their kids. Kids really pick up on how their parents are feeling or just other people around them. So if their parents are scared, sad, worried, etc., your child is going to become that way. And I know that sounds very difficult to do, but as a parent, just finding someone else, whether it's a spouse, your own parent, a therapist to take your emotions out with, and then try to keep them pretty reserved around your child suffering from a congenital heart condition. That would be very, very helpful, I think. It's the emotions that we have are way too much to deal with as it is. For physicians, I think it's great when physicians realize that we are still people with very big dreams. And when I've had cardiologists who have been terrified of what I do as far as, exercise goes. And I have cardiologists who have thought it's the coolest thing in the world. I actually have one of each right now. I call them mom and cool aunt. So, realizing that your patients want to do these things, whether it's what I do with fitness or whether it's pursuing a master's degree or whatever it is, traveling, give them the warnings that they need, but first encourage them. Don't make them feel so afraid, for sure. Let them know about resources that you might know of as well, especially mental health resources. It took me a long time to ever hear a cardiologist talk to me about a mental health resources, for sure.
Though you make some really excellent points, and I'd love to follow up on that point about mental health. How important is it, Mallory, that patients receive mental health support through their journey, and is enough being done to provide that now?
I think it's definitely changed from when I was a kid. The only really mental health support I had as a kid was my parents kind of forcing me to go to therapy, which I hated because you can't force somebody. So I think great things to do, and maybe it is happening now. I haven't been, a young patient in a long time, would be for the clinicians themselves to just provide the therapist, don't make it seem like it's a big deal. I think therapy is a lot more normal now. Hey, here's somebody specifically that knows about congenital heart conditions that you can talk to, rather than putting it on the parents to go out and find someone individually, and it's going to feel like a forced thing on the child. It's definitely important. It wasn't until pretty recently that I, decided on my own, okay, I should probably go to therapy. And when you make that decision on your own, it definitely really helps. Probably 6 months after my transplant, I did an intensive DBT training, which is dialectical behavioral therapy. I did it virtually. It was 12 weeks, 4 days a week for 3 hours a day. And it was life-changing. I used to have so much anxiety, especially surrounding my health. I almost canceled a trip to Europe to be with Global Heart Hub because of the anxiety. And after just doing that therapy, I mean, my anxiety is so much better now, and I'm out here chasing my dreams. So mental health support is very, very important, especially because heart conditions do affect your brain. Being on bypass affects your brain, all of those things.
Thank you so much for being open about that and sharing with us. Talking about that, I'd love, Dr. Ramchandani, from your perspective, what impact does mental health support or mental health states have on a patient's care and their physical health as well?
I believe that mental health is extremely important to provide our patients with at least access to or the option for mental health therapy, especially because, for example, in the environment I am currently, there's like an overbooking with psychiatrists and psychologists. So unfortunately, our patients, if they try to go through our hospitals, sometimes are quite limited in the amount of sessions they could receive, or if they could receive any sessions at all, depending on the appointment, on the bookings of our therapists. Because apart from us, there are other physicians who also refer the patients to these therapists. But I do think it's important because it preconditions the patient through, even before the surgery. Trying to be in contact with these type of specialists allows them to have a mentally smoother course of surgical and the postoperative course, because it allows them to face the struggles which lie ahead. And once they have faced those struggles, even to admit and to little by little adapt to the new situation. I think it's equally relevant for doctors to give physical care, but it's equally relevant for them to at least provide for mental care, because it's just another aspect of health. You have the physical and mental health, and both are important aspects, and both are relevant and should be provided for.
Absolutely. Sort of to touch on one of these themes of the support that patients need, Elena, if I could ask you about one of the key themes in the book you all published, which is about how important it is for a patient to have a supportive community around them. Can you expand a little bit on that? What kind of support do patients need? What kind of support do communities need to offer? And what role does a patient organization play in providing that support?
Well, there is, just before, there is something very important I have here from Mallory and as well for Dr. Ramchandani, and is the first one, the first idea of being isolated because of the disease, and the second one is the positivism. So it's just that's the way to go from one side to another side. That's I think is a difficult way for every single patient. So you have to learn how to deal with that. And as we mentioned before, it's difficult to do it only as a person by yourself. So in that case, it's important to have someone that is exactly, or is in a very similar situation as you are. So you are telling us stories that, the other person is understanding, that feelings and emotions, and that's important. In another way, again, it's important to have that physician as a sort of, in a way, a sort of friend that you can talk to in a very easy way, just to understand the situation, how is going to be your life, and what's the best thing to do, and in the other side, the third pillar of the situation, in the patient situation, is to be part of the community in terms of the patient association. It's just because it's important to be supported by your close ones, but in the other way, it's important to it's like a sort of take advantage of the resources that a collective or a patient association can provide to you. In that way, for example, the book is talking about all those things, When Cecilia told me about the story of the book, how was the origin of the book, she mentioned that the origin was that they were a group of friends, a group of patients with a congenital heart disease, and not so a long time ago they decided to write this book just to share those learnings and those feelings to other patients. And it is a book that is not relevant in terms of literature or linguistic or grammar, or it is important in terms of hope, because you see that in every single story you see a piece of hope in a different way with different situations, but all of them, they have a point in common, that is they don't still given up to the situation. So they are fighting from the beginning, from like Mallory, from her, she was born as the same as the other patients. But if you are a newly diagnosed patient, or you are the mom and dad of those little child, and you are told that your baby has that type of disease, whoever, congenital cardiopathy, I think it is a situation that is really, really difficult to cope if you are by yourself and just thinking that your world is, falling down and falling down. So it's important to feel that you are part of a community, that you have support from other patients, from physicians, and even from the technical point of view, that you can be aware and informed by the different research, and even to promote trials, and just for for the patients to realize that the community is working on that, and and you are part of the community as well, and you can support and help the community.
Absolutely. So I'm kind of hearing that patient organizations get to help fill two separate roles, one in delivering resources, information, guides, trying to help break down some of that information that can be a little bit overwhelming or complex. But then there's also the other side, which is a peer community, and you can connect with other people who understand what you've been through and access some of that peer-to-peer support, both the patients and the families and carers around them. And so patient organizations do kind of help facilitate that support. And I think that's a really good thing for patients to be able to take advantage of.
And it is important to highlight that from the in this case, AEPOVAC or whatever patient association, we are not physicians. We are not to tell the patients just to have this treatment. Oh, this is whatever. Oh, this is your diagnosis. No. It's just we are going to help you. Very important, the mental issue. We are going to help you to cope with the situation, because we are in exactly the same situation as you. And patients, they are the best way to understand and to deal with that and be positive, and and just to realize that that you deserve a normal life, because you really are a normal person, as Mallory, for example, and Cecilia as well. So it's important, yes, to clear that,
Absolutely. I'm curious to know, Mallory, if this rings true to you, and what advice you might give to patients looking for support and maybe their family and friends looking to give it.
I'm glad that you asked. I was just thinking about this. The advice that I have is maybe not something you've heard before. So as a patient, one of the best things I learned was to actually support your friends as well. I think that we are so wrapped up in being sick and having all these health issues that we forget that the things that might seem trivial to us that our friends are going through are the hardest things they've ever gone through. So to them, it's the same, everyone's experiences are relative. So when I really learned to stop talking so much in my friend group and listen more and just support them, my mental health improved a lot. I think that when you when you take the time to stop focusing on what you're going through and just let your friends talk, your mental health will really, really calm down. And then as far as like friends looking to support your friends, I read a really great book. I have another friend who's got a different health issue. So I read this kind of, for her, it's called Being with Dying. And it's really just about a friend being with a friend who's dying. And it was such a great book, and I wanted to give it to all of my friends because at the time I hadn't had my transplant yet, but I was also like, yeah, I don't really want to push this on my friends, but it is out there. And it was a really great resource for me to support one of my friends who has a different illness.
Absolutely. If I could ask, because of the nature of congenital heart disease, patients may see a clinician or care team from a very early age and then for many years. So I'm curious, Mallory, how important is it, do you think, to have a really trusting relationship with your care team? And then how do you advise patients or their families to find or cultivate those kinds of strong relationships?
I think it's really, really important. I have been pretty lucky with the cardiologists that I've had. I only remember ever having one cardiologist that it took me a while to kind of get close to him. So it's really important to feel like you can tell your cardiologist anything. Sometimes I have definitely felt scared to mention some things that I do because I know they're not going to be thrilled. So don't be afraid to ask for a second opinion, to maybe ask to see a different cardiologist within, the same hospital. Don't be afraid to ask for multiple cardiologists on your team. Especially when you have something pretty complex, when you get into the transplant area. Gosh, I think I see like 5 of them now. Yeah, I mean, connecting with them almost like they are your friend is really important. You're going to see these people for a really, really, really long time.
Dr. Ramchandani, I'd be curious to know your thoughts here. How do you cultivate a trusting relationship with a patient? And what advice would you give to patients and other doctors?
I believe I'm in consonance with what Mallory said. The physician or the group of physicians who are going to take care of you during the history of the congenital heart disease is a group of physicians who will be for a very long time following you up. So you have to be quite open with what you want. They will tell you, they will warn you with statistics, they will recommend you types of lifestyle. But at the end of the day, you are in charge of your own life. And that is one of the things that the patient should know. They are in charge of their own life. And they have the power to take the decisions. We as physicians recommend. We recommend based on scientific evidence of our own experiences. But at the end of the day, it is the patient who is in charge of his life and who has to take these important decisions. So it is very important to be quite frank with the physician of what you want, or what you are expecting. A patient should be should know how to transmit those needs, and the physician should be has to be quite open, seeking for these kind of information, trying to understand what the patient needs, what is looking for, even if the patient is not quite sure on how to verbalize it. And sometimes you can't verbalize this in the first visit. You need quite a few visits to try to make a connection with the patient, because the patient-physician relation here is quite important. I might say it's a lifelong relationship. And our goal is to provide any improvements in health, physically or mentally, so that patient could have a whole life. But without knowing what that patient needs, it'll be quite difficult for us to know how to provide for them. So it's quite important to know the objectives of those patients in their life, or try to understand their lifestyle. That's why one of the most for us, one of the most important questions for us or topics is to understand what type of life they have. What are their hobbies? Do they like to do sports, or do they like to go out for frequent trips? Or because that allows us to, for clinical decisions. For example, it's not the same thing when the patient needs heart valvular surgery and we have to put a prosthesis. For us, it is really important what type of lifestyle that patient has, because depending on what lifestyle that patient has, we might be able to recommend a biological or a mechanical prosthesis. And it's true that scientific evidence gives us quite a lot of data depending on age, sex, comorbidities, which type of prosthesis is better for which type of patient. But at the end of the day, those are just information which will help us decide for the recommendation. But the last word is the patient's word, because it's at the end of the day, they're also responsible of their own condition. They are the main actors of the whole of the movie. So they have a quite important say in this decision. And our recommendation is completely based on their needs, their objectives, and their lifestyles.
Absolutely. You know, you're hitting on some really key points here, which is how a trusting relationship between a physician and a patient doesn't just help them feel comfortable, be able to ask questions, but actually allows the physician to make better informed treatment and care decisions. And I think that's a really crucial point there. I'm seeing we only have a few minutes left. So to close out, I'd love to have just, you know, a closing statement from each of you about what the value is in letting patients speak for themselves. And, you know, Dr. Ramchandani, you've already touched on this so well, but basically, like, what is the need to center the patient voice? Elena, this is something I noticed the book does very well. So maybe you could give your closing thoughts first.
Well, really, the most important is just the patient. So at the end of the day, the most important is the patient. And it's you know, very, very interesting what the Dr. Ramchandani just said about, you know, just to take decisions together with the physician, with the surgeon or the cardiologist, because it is important to keep in mind the patient's life as well, you know, the type of the hobbies or the work or wherever. And also it is important just nowadays, because the patient is in the center of the public policies. So it is really important, you know, to for the strategies and the cardiovascular strategies and the, you know, just to, you know, to have the patients on the top of the, you know, the top level. And for that it is, you know, it is important to hear the patients, and it is through this book. And as I mentioned at the beginning, they are stories of life and hope, and this is the most important.
Absolutely. Thank you. Mallory, if you might be able to give your closing thoughts next.
I think that it would be so wonderful if all physicians realize that patients have an extraordinary ability to inspire. The things that we achieve are just so impressive. Okay, so you know, seeing a congenital heart patient who's, I'm talking about myself here because I know my story, who has been through 6 open heart surgeries and a heart transplant, become a bodybuilder is like, wow, I can do anything if you see that. So if we have more room to be a voice and show the things that we have accomplished, it's really, really going to inspire other people, whether they have a heart disease or not, to maybe take control of their own life and take control of their own health. And then maybe they won't end up in the cardiologist's office ever.
Absolutely. Thank you so much, Mallory. And Dr. Ramchandani, if you could close this out.
Oh, yes. I would like to close this with a phrase of a famous Spanish philosopher, Jose Ortega y Gasset. And he says that I am me and my circumstances. And I think, as I read through some of the comments written here before, that doctors should have patience. That's completely true, because we need to understand the patient in its biological and medical needs, but also in the patient's circumstances. So that's fundamental. That's really important for the decision taking, because the patient and his circumstances, and much of the congenital heart disease, the future and what we are being able to provide is being written now. Many things in congenital heart disease, especially in future perspectives, are still unknown. So that's with the improvements in therapeutics and the surgery and patient care, these things are being written now. So right now, what we have to see is each patient individually and with their circumstances.
Absolutely. Thank you so much. And I see we are out of time, so I just want to take a moment to thank all of our panelists for being here and sharing your experiences and perspectives with us. I know I got a lot out of this conversation, and I so appreciate you joining us. I am grateful as well to have been able to partner with AEPOVAC on this webinar, who does such excellent work, including their recent book. Thank you as well to everyone in our audience. I hope this was valuable for you, and I appreciate you spending this time with Global Heart Hub and AEPOVAC. You should see a survey for this webinar after exiting, which I hope you'll take the time to fill out so we can continue to improve. For anyone interested in learning more about our work, I encourage you to reach out to me. Thanks again, and I hope to see you at our next webinar. Bye, everyone.